Charles Malpas. I'm a research fellow at the Clinical Outcomes Research Unit and the Melbourne Brain Centre at the University of Melbourne. And I've been here at ECTRIMS presenting some research on what we classify as aggressive MS. So when we talk about aggressive MS, we're talking about a particular subset of patients, about 6%, who develop a particularly early disability in MS. And the reason why we're interested in this is because we'd like to be able to predict which patients are going to go on to develop early disability in that way, and those who are not. It's very easy for us, of course, with our large databases to look back and see 10 years later who developed serious disability, but we'd like to be able to do that using information that's available to clinicians and patients in the first year when their symptoms started. So that's the aim of the research that I've been presenting. So we used data from MS-Base, a large international study of patients with MS, and we looked at predictors of aggressive MS that would be easily available to clinicians. And what we found was that patients who tended to be a little bit older when they had their first symptom, patients who had more serious disability in the first year since their symptoms started, and also patients who had particular neurological findings were actually at increased risk of developing aggressive MS. So we developed an algorithm, so a little equation that helps us predict who those patients are, and then we went through and we actually validated that. So we contacted our colleagues at the Swedish MS Registry and we tested our predictions in a completely independent sample of patients. And what we found was that fortunately it worked quite well. And so our next step is to try to translate that to help clinicians identify these patients early, and then ask other questions. For example, how do different treatments affect patients who might be at risk of aggressive MS versus those who are not?